Hello everyone and welcome back to my channel Dedicated Dentist, where we probed industry 32 reasons why. So far we discussed the removable myofunctional appliances. This video will be about fixed functional appliances, that is Herbst and Jasper Jumper. We know that the orthodontic appliances are broadly classified into removable and fixed. The fixed appliances cannot be removed by the patient, whereas the removable appliances can be easily worn and removed by the patient, due to which the patient compliance is affected, as these appliances are bulky, like activator and functional regulator. So because of the discomfort, they might not wear it, and this will affect the patient compliance and treatment. Starting off with the appliance herb, but the most important point I want to make today is these fixed appliances, that is herbs and Jasper Jumper, are given when there's residual growth left, because we know the myofunctional appliances are generally given in the early to late mixed dentation period, because at the time the growth potential is high, but we give these fixed appliances when there is only residual growth left, or we can say that the patient is near the end of growth phase. And just like the removable myofunctional appliances, even these fixed appliances are more commonly used to treat the class 2 cases due to retrognathic mandible. These are also indicated in mouth breathers, since the removable appliances are really bulky, like activator, they hamper breathing. So this is why these can be used in the mouth breathers, used as a retention device post orthognathic surgery, can be given to uncooperative patients or patients who have temporomandibular joint disorders. Now this has a bilateral telescopic mechanism. We have a bonded Herbst appliance and a banded appliance. So we have this assembly telescope like thing which has two pivots. Pivot is a point at which the something moves or turns. In the bonded type, we have acrylic splints. They are covering the buccal occlusal lingual aspect of the posterior teeth. The pivots of assembly, they present distal to the upper first molar and at lower first premolar. Then we have a banded type. The design is kind of telescopic mechanism that is attached to both the arches to keep the mandible forward. So it has this tube which is attached again to the distal of upper first molar, and there's this plunger which is attached to the mandibular first premolar. The rod is measured to the required length according to the advancement that we require to do, and then it is inserted into the tube. So this brings the retrognathic mandible forward. These appliances can also be used with fixed orthodontic therapy. Now, because of this Herbst appliance, there will be risk of dual bite development in patients with temporomandibular joint disorders. And because this appliance is rigid, the Jasper Jumper, which we'll discuss, is flexible, whereas this Herbst appliance is very rigid, so there will be difficulty performing mandibular movements, and the degree of freedom of mandibular movement is limited because of this. Then, as this it has bands, it is banded, so there will be enamel decalcification of those areas on teeth, and again plaque accumulation will be seen, so oral hygiene cannot be maintained. Then there will be open bind development in the posterior region, and flaring of lower incisors will be seen with every myofunctional appliances. That is why some appliances will be incorporated with the acrylic so as to do the incisal capping, as seen in activator and even bionators. Since there is downward and forward growth of the mandible taking place, there will also be flaring of the lower incisors. And this is the basic thing about myofunctional appliances that I've always talked about in every video of mine, that whenever there will be forward growth of the mandible, there will also be downward growth of the mandible, because of which there will be open bite, which is the reason why it is not myofunctional appliances are contraindicated in vertical growers. Since their vertical height is already increased, there will be development of open bite and increase in vertical height. And hence, the myofunctional appliances are generally given in normal and horizontal growers. And as there is a forward force on the mandible, there will be a reciprocal force on the maxilla. Thus, this will restrict the growth of maxilla or has an inhibitory effect on the maxillary unit. So you must bear this in mind, that the fixed appliances, they will cause a restrictive effect on the maxilla. There will be remodeling of the glenoid fossa and flaring of the lower incisors and distal movement of the upper molars. Next fixed appliance, we have Jasper Jumper, as it takes mandible forward, that is jumps the bite, hence the name. Unlike Herbst appliance, this is very flexible. The design is a modular system in Jasper Jumper. That is, we have this polyurethane tubing, and inside we have the spring module. Polyurethane because nothing adheres to the polyurethane. Needless to say, the oral hygiene will be well maintained because plaque won't adhere to it. Then we have stainless steel end caps. One end cap will be fitted in the upper arch distal to upper first molar, and the other one will be fitted in the lower arch distal to the lower canine. So Jasper Jumper appliance, just like Herbst appliance, can be used with fixed orthodontic therapy. Then we have this ball end pin which is inserted through the molar tube, and then it is passed through the end cap. So the gap is left between the distal end of molar tube and the end cap of Jasper Jumper. This is for the clearance to bring about the mandibular movements. If we want to do this stepwise advancement, we will pull the pin mesially and then bend it. And the length of this appliance will depend on the cases or the advancement required. These are available in sizes from 26 to 38 mm in the increments of 2 mm. Mode of action is, first we are going to calculate the mandible advancement we require. We'll calculate that length. The distance will take from the mesial end of molar tube and distal to the canine. To this we'll add 12 mm, because when the mouth will be closed, this Jasper Jumper or the spring will curve. So we'll add this 12 mm for the curvature or clearance to bring about mandibular movements. So there will be force module is longer, it will tend to curve and produce mesial force on the mandible and reciprocal or distal force on the maxilla. This will jump the bite, that is take the mandible forward and have restrictive force on maxilla. Thus we can correct class 2. So as there is downward and forward growth of mandible, there will be clockwise rotation of mandible, change in point A and point B, point A on maxilla, point B on mandible. And this is true for every myofunctional appliance, that there will be flaring of lower incisors or intrusion and distal tipping of upper molars. With this, we finish the myofunctional appliances chapter, and I hope you find this useful. Thank you for watching.